Unexplained infertility is the situation where the woman's fallopian tubes are open. She has normal egg scores. Her husband's semen analysis is adequate, and she's been having timed intercourse with her husband for an appropriate interval of time. For a 35-year-old, that's typically greater or equal to 6 months. So there's 3 elements in play in unexplained infertility. The first is eggs not getting fertilized. The second is the fertilized egg not making it to day 5 of life. And the third is the embryo makes it to day 5 of life, but it's chromosomally abnormal. So when those 3 elements are in play, we typically move to one of 2 therapies, either IUI or IVF. In women less than 35, the pregnancy rate in unexplained infertility was 11.5%. In women who are 35 to 37, it's 9.2%. And in women 38 to 40, it's 7.3%. So you can see in this diagnosis, going to IUI is not very beneficial. And we really don't expect it to be when you think about it, because a woman is given Clomid or letrozole to help her ovulate, but she's already ovulatory. And we're placing sperm in the womb, but if the semen analysis is normal, sperm's already getting into the womb. IVF actually solves all 3 problems. We gather eggs, fertilize them, grow them to day 5, analyze those embryos for chromosome normality, and then freeze them. So let's take that 35-year-old woman as an example. Let's say we, at IVF, retrieve 14 eggs. If we have an 80% fertilization rate, that's 10 embryos. We watch them developmentally. On day 3 of life, there's 8 cells. But on day 5, there's 150 to 200 cells. And that embryo has differentiated into an inner cell mass, which is the child, and an early placenta or trophoblast. So on that day, we take a sample of the early placenta. We don't touch the child. We amplify that DNA and get a chromosome call. So the efficacy of IVF, if a couple produces a chromosomally normal child in elite laboratories, is 65 to 70% live birth rate per embryo transfer.